social media channels. And that is all I have for today. Thank you once again for joining us today. Thank you to Dr. Chen and UCSF Health for having me. I'll take any questions if there's any in the chat, but have a great rest of your day. Thank you.
Thank you so much, Stephanie. I appreciate both you and Renell for your dedication to us across the state. I think it's important to know that as these resources get sent out, they're available in both Northern and Southern California. I don't see any immediate chat questions, so I think we'll just keep going so we can get to our Zoom panel and the other Zoom room. I wanted to draw a little bit of attention to ways that folks can contribute and give back. I think part of our discussion today is about community, about networking. And as someone who is an educator and has been teaching at the medical school for many years, I recognize that it's important for us to teach the medical students who become physicians in other specialties besides OBGYN about gynecologic cancers. We have a really special program that we're able to participate in here at UCSF called Survivors Teaching Students. And I think this is a way that we can engage all of you to help all of us in being able to speak to our medical students. You telling a story, you on a panel are so much more impactful than me giving a lecture with bar graphs and charts. I wanted to introduce Sara Vellve and again, Stacey Ross to talk a little bit more about Survivors Teaching Students for just a couple of moments. Thanks, guys.
Good afternoon, everybody. So Stacey and I participate in a program called Survivors Teaching Students, and it's a program that is sponsored by the Ovarian Cancer Research Alliance. And what we do, Stacey and I are patients/survivors, and I use those two terms interchangeably because I believe that even, at any point in our cancer experience, we are surviving cancer. So I kind of tend to lump the two groups together. So we both participate, a number of the panelists who you've seen today participate in the SDS program. It's a national program where survivors go into programs and the classrooms for medical students and talk about our stories from diagnosis through treatment. And by highlighting specific pieces of information like symptoms, hereditary mutations, we are able to really focus students on how to potentially look for what could be cancer, could be gynecologic cancer, rather than sort of the IBS or the GI problems that many of us experience. Sorry, this is, I'm trying to just really give a very brief recap of a longer presentation, so it's a little disjointed here. So what we do is we go into these classrooms. Again, this program is a national program, but here in the Bay Area, we go to Stanford, we go to UCSF, we go to Truro. Up on Mare Island, we go as far north as Sonoma State, we go as far south as San Jose State, and we do these presentations for students. There's 2 to 3 people per session, sorry, and we each give a presentation. Stacey, I'm going to have you talk very quickly about what those presentations are like and how we get to forming them.
Yep, sure. Thanks, Sarah, and you did great, by the way. So this is, again, really where students learn about the disease of ovarian cancer from those, from whose lives are affected by it. And so as far as the actual patient presentation, someone like ourselves, or like many of you out there who are patients, will have been trained and coached to write your story in about 900 words or 5 to 7 minutes. It can be very emotional, cathartic, and can be very empowering. And people get to share in the way that feels right to them. And essentially, part of the training is they will want you to include major milestones and timelines in your story. So things like risks or family history, your journey to diagnosis, what was that like, especially your initial symptoms? Were you passed around from doctor to doctor thinking symptoms were GI related? Who did you eventually find to treat? Did you go for a second or third or fourth opinion? Was the treatment effective? Perhaps not. Perhaps you're having a recurrence or two or three or four, like myself. What is that like? Or did you look into any clinical trials? Were you fortunate enough to have friends and family with you around to support them? And also, they really want to know personally how this has touched you. So, for instance, did you celebrate when you finished chemo, and how did you celebrate? And what does your current state look like? And so really it's about putting the personal touches on, I think, the clinical disease. And really anything that affects your life, they want to hear about. And everyone's story is unique and special in their own way, and there's no right or wrong. It's what's special to you. Typically, there are about three presenters and a facilitator, and all the stories are followed by a Q&A. And the feedback is really showing that it can really change the trajectory for these students. It's just, if we have time, I just want to read a quick quote from an email that was just sent from the previous presentation. As I continued my workday, I was stopped multiple times around the office by people thankful for such a program and wanted to let you know that you touched around 200 people through the online attendance and people in the room. All feedback I got was positive, and there was a renewed energy and passion for what we do. And so, it's really, I think, to remember the most is that without early detection, for ovarian cancer, spreading the word about symptoms, especially to those who are going to be treating these symptoms in the future, is a really effective way of finding the disease sooner, and literally positively affecting survival rates. So with that said, Sarah, I'm going to pass it back to you.
Okay. So essentially, the gist of our presentation here is to try to motivate people to sign up and become presenters with the STS program through the Ovarian Cancer Research Alliance. It is a really, really wonderful and very gratifying role to play in the students' lives. For even 5 to 7 minutes, you're making a huge impact on what will be their medical experience, profession. They love hearing from us. They're super appreciative, and they will, in the future, they're able to refer back to these stories and at sort of a blink of an eye and say, oh, she was talking about these symptoms in that program that I saw her. And this actually really works. We have data showing that these educational presentations help to inform the medical profession on how to potentially diagnose not just ovarian cancer, but other below the belt gynec cancers as well, because someone may be presenting with these symptoms, but you could have some other type of cancer. So this is all to say, please join us. It's a wonderful program. We've met really great friends. It's a lovely community. We meet outside of our presentations for coffee sometimes and talk, and it's just a wonderful community building and educational program to be part of. There will be in your gift basket that Kevin sends out, there will be links to the STS program, plus the name, plus the email for the woman who coordinates the Western Regional program. So look for that in your gift basket, and join us, please. Thank you so much.
Thank you.
Thank you both. I think that you would both agree that our STS program has been a huge success, and this is a part of the symposium program that I want to take a moment to acknowledge the founder of our STS program here at UCSF, and that is our friend and colleague, Ms. Julia Young. Many of you know Julia from our in-person symposia. She was always the one that brought lots of books and lots of scarves and lots of things for us to be able to trade with one another. Julia was a patient here, ovarian cancer survivor, a fighter. She was somebody who was a facilitator, and somebody who brought us all together. She really worked with Dr. Weta to develop the first incarnations of this symposium and really was a leader of our group of friends in our friend circle. We recognize Julia for her education, and the medical students gave a tribute to her earlier this year as well in our department awards of recognizing the key educators that have made a difference. So I wanted to just spend a moment of acknowledging Julia and that we miss her every day, that as we do this symposium, we think of her and we think of Ray and her family and all the things that they've given to us. If you would just spend a brief moment of silence with me.